Hello, and you're welcome to the studios of GH Police TV. As you are well aware, the month of October has been declared worldwide as the Breast Cancer Awareness Month, or as mostly referred to as the Pink October Month. And so for today, we have with us here a personnel from the Ghana Police Hospital who is going to be walking us through cancers, and specifically breast cancer. And for the purposes of this session today, we are going to be running it in both Chi and then lace it with English. And so if you are home and watching us, do not go away, stay with us as we bring you what you need to know about breast cancer. And so to the studios here, we have Deputy Superintendent of Police, Mrs. Harriet OWUSU-ADJAH, who is a specialist nurse oncologist at the Ghana Police Hospital. You're welcome to the studios of GH Police TV, Madam.
Thank you very much for having me.
Thank you. Madam, we want to talk about cancers. We have heard a lot about it, and I'm sure most people at home watching us right now would want to know what cancer in general is.
This October is Breast Cancer Awareness Month, as already said, and we call it Pink October. So breast cancer awareness is all over the world. And when we talk about cancer in general, it's a disease that has abnormal cells growth, and the cells grow to the extent that you cannot control them. Their control is not possible. In a natural existence of the body, we call something cell. To the benefit of me speaking Twi for them to understand, we call cancer in Twi kokram. So if it's breast cancer, it's kokram ewo. So with cancer, abnormal cells growth that cannot be controlled, that is cancer. So when this happens in the breast, we call it breast cancer. So with breast cancer, I would like you to as cells of the body. It means it's just an example of blocks are yedisidine. So yendi paduane nyina ye blocks are cells no blocks are yedi aye ni paduane wo ye organs no ufa breast ufa other parts of the body nyina cells no na aboabo ne ho aye tissues of the body. So in the breast your tissues so and cells nyina na aboabo aye tissues in the breast. So these cells in the breast, whenever there is abnormality, if they overgrow, they do. It's just like who sit down, who wall no, na, who the block no, sanka who na cement no, who lay baby and I one yen smoother. Once I die no, a bear po cement na bear po until sana cancer no so tea or nipa no phone. Into a basa cells no multiply. Omubu so sa na ye po e wo no fom. Nti na e be breast cancer.
Thank you so much for this education. Madam, you titi nsem bebre afa ho. Ebi kra say breast cancer any cause and any ma de credible. Ebi so ebi a will live this kind of lifestyle and the breast cancer but you titi bebre. But then the wa be walk us through what some of the causes of breast cancer are.
Okay, before then, anytime they say breast cancer or anything cancer, and people get scared or they are worried about the fact that they mention the word cancer. And we see realize that there are so many cancers, but breast cancer is the most common cancer. And a female, most common in female, both in the Western world or in Africa and all the places in the world. So when you ask about the cause of cancer per research is not known. They are still researching the cause of cancer and any other, but we have things we do that causes cancer. We call them risk factors of cancer. So as we are doing breast specifically, I'm coming to talk about risk factors that causes breast cancer.
Okay.
And these risk factors are divided into two. First one, you're modifiable risk factors. Modifiable risk factors Brofo kesiye means that nia yebetimi aye bibi wo. Nia ma me bebo so sesi ano. Nia yebetimi aye bibi wo. The other one, the second one is nia yentimi nyehwe wo non-modifiable risk factor. So the modifiable one, the first one is lifestyle changes. So you realize that the way we eat, yedidiemu, titeu, ebumudi sradinam, anwa bebre, any meka say brofo duane, burgers, fries, ni fried rice ni ekeka ho. Ni nyina ye eduane. Ba ebimudi no bebre, ade a omundi any healthy diet eka ho. It is any money in an utaya because most cancers no feed you fat so it's utaya. Won't say you can, it means risk. You may or you can have it. Then I can also about lifestyle and I lifestyle say alcohol intake. If you can, yes, no monsabe bre so wetimia uno monsaba untimi njai so say reducing sanom no na aboa smoking sane ayishinansen ye wo bia fresh shisha young ones na teteru abai one money young men no ya omunu shisha de ya say new type of smoking ni bi ni nyina etimi cause cancer because upafi ana uhu shisha ne ba ko a equivalent like 1 pack of cigarettes na wa hunti enye say bia 1 pack enye say bia smell no ye fine na say na yete no different aromas. Let me mention it like or flavors, sorry. It doesn't matter, it's still smoking. So yet me reduce smoking, it's good. So all these things are things I bet me aye bibia fa ho. Ba ko bi se ye ntanye exercise, lack of exercise, physical exercise. You can't exercise bebre join say utu mereka uko gym na exercise there ubetimi eno so ka ho ba untimi nko gym na because e bia sika na ukotua o gym no ubetimi take a walk awo area mu 30 minutes walk 3 times a week. It's okay for you. Until lack of exercise unya exercise eno so ka modifiable risk factors no and obesity ana being fat ana ewo ye kasam ye ka obolo for amuso those days so now has a riches and a bibi or culture but say see an yare and obesity is also one of them. And I be mu ebunya menopause once onya menopause hormones ring na say omo aba down omo aba low into omo pe other hormones ya e bi andro na omo no ma ebema omo hormone na ba back omo be feel young ni na ekeka obi omuti. But the more I won't hormone because season na aba say menopause aba untimi nya refund. But unu more hormones na obe say still keep you on sa hormones no cancer to me feed one no so. Yes, now one breast cancer. Into no na modifiable one. It means in the able to nyina it me bibi fa ho. It me aye ho bibi. Exactly. And a non-modifiable ones no. Ni entimi nya hwe. Number 1, your age. Cancer no striving in old age, the more you grow. It doesn't mean say if akola ntimi nya cancer, until now uti already only research ni nya say akola cancer is very good, it's curable. Most of the childhood cancers no is curable, but adults so aging every year everybody celebrates birthday. We do our things and honor ourselves. So as you age, that's one. You can't do anything about it. You can't stop your aging. Personal history so can it's one of the things I want to mean here from. Personal history as in when your breast cancer da and when your cancer be da, you can also get another cancer. Near also family history. Your friend of first degree family members. It means oh papa, oh mommy, oh sister, oh auntie, oh brothers. Now more if any of them are when your cancer da, you can also get cancer. You may or you can. It doesn't mean someone ya done so benye there be. You can. So family history. And a family untimi nka say me say I want to be part of OWUSU-ADJAH family. Ngemi na me kai nyankopon ana na ebo me. same as madam. And another one too is gene. If a gene be gene mutation, it means some particular family or gene be a etimic breast cancer, BRCA1, BRCA2, PALB2. They are some of the genes that can cause breast cancer more. If we know this popular American actress and actor, Angelina Jolie, she has a family history of this particular gene, BRCA1, BRCA2. The grandmother, the aunties and all that, they have it. They had the breast cancer. So she doing the test to know this gene the family has. She went to remove all the breasts. Yes. Or you need to plastic surgery one hour. Into your friend a radical management to prevent it, because it's the breast that the gene will work on to end up having the cancer. And early menarche say nkolana anwa start on menses intem na say 8 years 7 8 9 they have their menses and who have your first period. It means say omo homo be ejuma saa kopem omo yin nti saa homo na the moment e ejuma saa no na e bia wo saa ne ma yin na bia family bi wo bi that na be out of the blue they could also in the future have cancers of the breast or any other because of the hormone asati ejuma ntem. No na breast.
Wow, thank you so much, madam. And we come to the next set of explanation we want you to walk us through. Okay, so the working name yati na edien na be chire ana signs ana symptoms be edien na be bom kokko ana be ma mani aba me ho se eh ebi a me ye nya bi ana se ade we a koso wo me nufu mu ide. It looks like cancer. What will prompt me to know say what I'm experiencing in my body is actually breast cancer?
Okay. Ade abeba okoko ana be ma ohun say wanya cancer na bibi koso a say otu ana ma hospital. One bet over say onufu ho no. Baby our skin wo onufu no etimi sesa. Obia mba bia you particular about your skin. Nti wo say onufu no skin na wo ho no aye dark. Because who are unye dark, but we are dark, I won't say I had darker, I ain't your color.
Because now coming back the booster, because there are some people who are naturally dark, and then some others too are naturally fair. And it doesn't mean say the skin no you're dark, and now be a bibisa na.
And no be darker.
Okay.
A very darker, it's a very different from Tania with skin here or tear that. And apart from being dark, it's me a reddish, so a very cocoa. It's me a hot, so feel it a show. And ultimate who says about for them. And ye nipple no, and no for no, I have friend in nipple no. Ebi muno naturally, or mudia tom dada. And see, these people when they give birth, they educate them how to do it. No for no beba, colano be a piaba, colano benum. But in this case, who no for himself no for no ejinaho. I am tomb, but that could be sorry, and now one. Now I tomb, no, and also your sign say, if there's something going on, it could be this sign. And no for now I tomb, so apart from that, in discharge, whom me no for an hour, one, and she will start it, but a man won't yet breastfeeding mother. Who near oba, o manufu, and she oba. And she only to me bloody, it's me as a red, as a moja, it's me a white, it's me a yellow, colors. And no, one would say so to animal because I know soon ye a dear a tie and a dear normal. And I wore breast nankasa to me, I say, send your uncati and count into a friend orange peel symptoms put the ranch. It's a French word, but orange peel no I said dot view. Naturally, no or dot way in front of but won't to me, but when no, a bag glaring. A best shoe, now a bed dead, crana when and now ubet me a lamp, so send a boss lamp and a baby woman, and ye a banner I want for no naturally, no, and ye no man watching one I won't say we no, and shed down you. To we ain't signs and symptoms, and I near my oven who I be walk. You know, when you ask me to cause pain, and to say that you say if I start experiencing abnormal pain in any part of my breast, it be a mammy, I just say. I should see the medical
team for it?
Good. Often some come without pain.
Okay.
Most of the time some come without pain. Some too you feel the pain. But bibia e wo unu fo ne mu na bibia e unu fo na science dey nyina ma boss no. E breast cancer symptoms.
Okay.
But unya lamp, enye lamp bia ana enye bibia e ba unu fo ho a wo yem be hyew say e cancer.
Okay.
Because ansa na ombeka che say wanya breast cancer. Ye wo test ahudo a we ye ansa na omu de wa to catch us so wanya cancer. Say ni say na e kire. Ntenye ade baako ana science yi 1 ana 2 ana 3 bi nebe ma obanhu sa na unya hu aba wo wonfo mpe menya cancer na wa adwen afi na wa start say ehu abo no pa cho da bi.
Okay. Better was say. Now let's come to diagnostic tests. So o can be say you say pain back and symptoms be pain na be ho a my doctors no immediately ma declare say you have breast cancer. It's before say be declare say indeed you have breast cancer. Walk us through some of the tests that you go through.
Okay. So your boy also said diagnostic tests. Diagnostic tests no wo be be.
Okay.
First one na mebo hu they run is breast self examination. Okay. It means one kasa obehwe wonu fom. Eno no enya ade a itimi man utimi kire bebre ana itimi kire bebre say bibi ha but eno so temeboa. Enti eno so ye sene a wo ye no e process bi wo ho a sene a wo be fa ho steps bi wo be fa a wan kasa ahwe wonu fom a wo say aba bi wo ma na e bi nim
and I saying self
breast examination. Enti before a wo be ye wo be hu say aba bi wo wonu fom mu wo betimi wo be gina ahwehwe nim enti wo gina na obo sabi wo be yi wonu fo no wo yi wonu fo na wo kire ho ahwehwe ne mu a wo di won sa mienu e di atu sisi so na wa chon ho forward a little you move you push yourself forward a little then you see the difference between the nufo no say baako so che baako but naturally but we say that ko ya na asenia enso no so ana ne enso no I am more than no and also a question mark say odi na em nufo enye normal betu anamo it we we sa no. The next step I will say, ube peja, u left hand it means say uba be examine u right u left breast.
Yes.
And u peja left hand na u di betu u tiko aso u tiko say.
Okay.
Now amma muscles na wa hano. A peja ye. Now the one sa we first 3 fingers here make now they no padded side of the hand. Now they now to so sanity say 3 no. Ehwa very sensitive into bibia e wo mbia obetimi afeli natural abano so obetimi afeli na wo de no ebimu ye no circle round form ebi ye no vertical ebimu ye no horizontal nia wo petimi aye bia no na wa ye ba wo ba wo se wo be cover nufo no nyina nti wo ye no round say wo be cover nufo no nyina wo bia obetimi de insana se ebi ahyewu amotuemu fat side na wo amotuemu obe mia kakra ahwe wan kasa obe bo modin aye we a na wa change nsa no obe ye right breast say na me kire wo left no say ma na obe ye ma right so we repeat we a wetimi do nsa so afa okonkon ha because sometimes no lamps na na ba no emba no fo no sometimes etimi gina wo kon etimi gina wa mutum ansa na enti na hu ya ba hu say aha no enye so comfortable say wan kasa obe ye na the next test I'll be to me about one and more biome apart from the breast self here clinical breast examination. Okay. Into who now one cause I'll check you once in a while now I call clinic so and a hospital. Now trained nurse or trained doctor and a trained health personnel no also be yama or be here another near we have people no one cause I have a second opinion. Okay. And now we catch a doctor so person a routine examination. Even according to your age, you know, from 40 upwards, between a mammogram amount. From 20 to 35 or even 39, they can do breast ultrasound scan for you. Okay. But mammogram, no, so last year there was this research that shows that the mammogram 35 go upwards to 35 years upwards can also do the mammogram.
Okay, a mammogram na say the be amema me otifie na onni ma de kra fe the mammogram no. Obehunu say what is it? Na say ye ka kire no hospital ankoma na ye man kwahye no. So say normal test obeko eno ade na ye ankasa.
But so mammogram no ya say fidie machine bi a obeko. Okwan no bi na picture na wo we ne mo ko ana nipa na wo ho no obe kire wo se ne a obeyi wo nufu na wo de nufu na tu ade bi so se na obeyi ni nyana na angles na wa mutiom ne baby amebo ni nyana machine no obedane da na wa twa picture obehu na wa twa picture deep eno ehwe deep dan se na wo nsat me feeli aha owie na wa kire wa na obekire report wo se na ati se normal na bibi wo mu ebia bibi na wo mu na ye we ana enye cancer na enye cancer eno so timi kire
ultrasound scan.
Ultrasound so no so ya di a ukoda mpa so machine wo ho na omu di bibi ase gel bi atu no fo no na omu di ade bi aye so nti oye no na o hwe wo machine oye na o hwe wo machine eno so sa na your CT scan MRI.
Before I want to reiterate this one. So for our mothers at home and for ladies at home who are watching us, the ultrasound scan is just like when you are pregnant and then you go for a doctor's appointment. Now, yeah, they to say, and they are far away from the surface, who baby now show you, said your oil, and I said, and what's here, from the and yeah, they who be there is not anything scary. It is to check if there is everything okay with you. So I'm saying all of this because also just the mere mention or just the mere word cancer and you who bring it back. Go on more to say when you be pet and you who have it none so. I'm going to cry even before the sickness will even take effect or anything at all. So it is important and necessary that we explain it and then we teach our mothers, our sisters. And now I hear there are men who contract cancer too. So for everybody out there, this information and education is for you.
So before I talk about the aspect of the men, CT scans are the MRIs, biopsy. And CT scan MRI, no so you feed the machine. Obeda so no mo ahwehwe mu. Akọ deeper than senia ni amika di nkan no ye. And a biopsy no die. Eno a surgeon, breast surgeon and a general surgeon and do be theater no mutiam ama within an hour or two no na mo wie. Eno no mo di panie bi di beti abana kakra akọ hwehwe mu e fide so say cancer na anya cancer aha no so ye nti no na those are some of the tests nti e we no so no who say breast steps in breast self examination e was screen no so na e be ye and na we na simple we about you we ye mama for you grandma for you nyina nkola wa around if your phone yi ma mo boss ma say breast self examination beba na say na obey ni nyina picture no beba omuyama wa na wankasa wo so simple na waye wankasa examine wo breast.
Thank you so much, Mamenes. Now I want us to delve into treatments. Okay. Is there hope? And that's all homo obia you are diagnosing already with cancer, breast cancer. Is there any treatment that is available to anybody who is diagnosed with such?
Okay. Before then, you asked of whether men also have breast cancer. Men and women, both, they have. But the women are the most affected, mostly affected because we have the breast tissues more glaring than the men. And men, according to research, 1% of men. So when you take 80 men, 8 of them could have breast cancer or might have breast cancer. So that's the aspect. With treatment depends on so many factors. It could be age, the stage of the cancer. So I would like to hammer on the stages of cancer. It's so complicated, but just simply understand says cancer was stage 4. Stage 1, cancer na wo abeto wonu fonu. Ni hoji say bia wo ye wo examination obetimi ahu. Stage 2, e wo ho ba asa ye kese ba. Nyini ba. Stage 3 no anyin kra ba. Ebi kra apie e wo nufu ne mu. Stage 4 no apie
said now we say you start feeling say discharges na say be a color
discharges be ba color ne be sani ama be koso but aba no so be kese a wo say aginifu no nyina e na stage 4 no agye for no musa no spread a traffic senia e has a seed enyi senia ye kan say cell no e bopo enti e pon no e wade bi mu aye onufo na onufo no e size bi enti enyi with the first stage na betom e ye kakra na ye second enyi agye nufo num na ye third etimi pai nufo kra timi pai na e ye ekuro na ebi mu kra didi cancer na ebi mu be didi akọ on say nufo no e wa in front of your chest etimi didi call chest mu etimi call sisi wo bones sabi wo brain ebi mu kon ni all the places are and other vital organs na our body mu etimi didi kom and na e friend metastasis it means a spread normally we use the word say hey ni cancer na spread you no so we do stage na ya advance that stages maybe enti stage no age no ni type of breast cancer na be chere treatment kura on be ya ma enti treatment number 1 timi e bitimi ye surgery no so normally no omutimi ma chemo so ye one treatment chemo no e ya sesenia ye ko hospital na omudi nsuo SES so pictures na be bana mahu no omudi nsuo SES so by no omudi cancer do ni gu nsuo ni ansa na e ko wo veins drip so but no cancer do no wo drip ni mu ansa na omudi amaw enti normally no ansa na ebi mu ye surgery ma no ombe ye chemo kakra ansa na surgery ta chemo kakra no emma cancer no emmoa mo e shrink emmoa kakra ansa na odi wa ko theater yi na ama aba together ansa na aboa no thank you aboa no ansa na wa ye surgery ama and if any new adjuvant therapy it means say ye be ye chemo no ansa na ye surgery no ana o ye surgery ni wie a na wa ye chemo no eno ye adjuvant therapy nti ye wo different way I ye friend no ye brofu kese ba no say surgery o we surgery na wa ye friend say chemo no nti new adjuvant ni adjuvant so another one is abi o ye surgery no so we a wan ye chemo no a e fe no localized treatment wan ye chemo no obetimi aye radiations eno no e fidi asese na x-ray no uko hoto na mo se kwatwa photo wo chest na wa ko ada so sa na ete ne nyina o picture no mu ye kana ma kire mu se na machine no look like se na nipa ne dem eno so nti ye surgery ni we a doctor no so ko hu school nti on e be kire se we ye be ni chemo we ye be ni radiations ana ye de ade ne be targeti e de aku anahye cancer na e wo ho no mu nti e fe no radiotherapy it targets the cancer na e wo ho no ena chemo no ma kan ho asem da ba ade ba kwa meka o chemo no say bebe ka cha chemo yi de eku nipa o ni nyina ye myth to say e ade a ye nnim because a lot of people say on ye chemo na skin no be common say nipa no skin say bi mutumi ye tum very darker ne tiri nwini nyina tutu ne nyina ye niama e si wo nipa due ni mu e ha systems bi mu emra esan yare ni wo other systems no mu it will happen like hair say no e koni nyina tutu wi a e kire nti o meka to say was scarf use the cap muffle ani ni amaniama e kire won say hairs no e go back very well nails ni nyina bi mu benya no vi obi mpesa o mu fi nausea e bi mu kra be fi obe fi saa ni nyina do ho a ye de be mouth for efie no ba more than that on be mouth na o maye be comfortable.
Okay, doc. I'll come back to you now. But for all these explanations, I can understand that they may be uncomfortable losing your hair and then your skin darkening and then your nails and then all of that. But they are all for your treatment. They are all to help you to get better. So they are uncomfortable though, but because it is geared at getting you to a safer point or getting you cured entirely, it is a safe treatment to go for. So for viewers out there at home, if you have been diagnosed with anything breast cancer, do well to adhere to these measures and then your health will be restored. Yes, please.
So treatments no yes to us so your very so hormonal treatment. Okay. Hormones bi o ho ayede meba. E di kan ka say hormones na so ebi mu so feed wo cancer no so. Nti your hormones estrogen, progesterone, HER2, they are very homo specifically now. Eya, omu hwehwem na omu hu say eye no a, let's take this example say estrogen e causes cancer na. Your test ayeye. Estrogen na ombema o say estrogen type of hormone treatment ekwa target is enim senia ebe ye ejuma afa ho. Progesterone hetu ebi so wo ho a ne cancer no enye 3 of them kora e friend triple negative since negative ti enhu hormone kora eye na no de na omoye another test for you to know further. I know na treatment na ye wa immunotherapy and also omubema of treatments na ebema we immune system no ankasa be fight cancer no oh honum.
Okay, so I can understand this one. Maybe I arena my immune system na aba form. And then you have to do these tests and then to help you to boost your immune system.
And when they boost the immune system to fight the cancer itself. So and also we draw therapy ebema we in fight against.
So then it means there is hope.
Yes, there is, because as a cancer nurse specialist, as a specialist nurse oncologist, we give hope to people. Yes. We are not God, so you cannot say somebody will die today or tomorrow. But all also boils down to the early detection. It saves lives. So it's so important. So me to also the supportive care and palliative care and also a part of treatment. And no. As a by advanced stage, I croniama bebre see doctor for be boa ba won say boa no enye we training ho am be ye fa sam one because most of the people omko prayer camps omko osofo ho omko other places enye say osofo ho onye but you believe say God gives people the mind to learn omusu ade na nyankopon nim die na chu tu ade na watcher eya kosuamu na ye dia paachi ni padie na onu aye nti ye paachi no pastor ana father ana reverend so eye spiritual de nti obema o di physical na beba doctor ho na wahwe mu ama o na spiritual no so na dey attach ba unjai doctor ho awa kosua de so many years na wajai no na wakoda pastor ho days months ebi mu kra years na cancer no esia the kind say it grows, multiplies. Enwu etiwo nti wo so mba no ebu mu sabe mu de be football ebu be kro into supportive care ya meka no ombe ma it means say they will do things to improve what your care quality of care na omde be ma ebia otie o ya na o mama we ufia na o mama we na e so kakra sa kopim time anyankopon be frɛ no dear. But it won't leave you, won't give you false hope or anything. But you are in God's hands. So we do the quality things for you, correct supportive care. Even in the supportive care, we have the psychological care.
Okay.
Because they need it's very, very important.
Sure.
So the psychologists, the psychiatrists, both of them could come in. Because some people break down.
Yes.
They don't even talk to anybody. Their family, they don't care about them and all that. And vice versa. Family support is also part of the treatment. Some husbands, especially, the mere fact that their wives are being diagnosed of having breast cancer. Our marriage is what there is divorce, so marital problems. So this person has a lot to think about. And so was emotional support and spiritual. Mama pastor, anointing or whichever, and apart from being a Christian, any other religion I want who will be a penny or over friendly panel, not spiritually, no. Now I take care of. Near so or your mouth, attending to doctrine. Now I know so why a treatment.
Thank you so much, ma'am. So let's talk about prevention. Okay. So we have had a lot about breast cancer. What causes, and we say we cannot pinpoint exactly what the causes of breast cancer are as of today because still there is research ongoing to get what the causes are. We have talked about diagnostic tests. We have talked about care in all forms of care, even when it's in the first, second, third, or even in advanced stages, and all of that. So what at all should we do as women, as men, or anybody at all to prevent breast cancer?
Okay, thank you. prevention of breast cancer is in so many folds. When we started the talk, I remembered I talked about modifiable risk factors.
Yes.
The things that we can do something about. So number I made mention of obesity.
Yes.
So it means that we need to check our weight. Okay. Checking your weight not necessarily mean just climbing on your scale in the house to check your weight. No. What you eat, because human as we are, when you are growing fat, you know you are growing fat. You are growing lean, you know you are growing lean. And even in our signs and symptoms, one major signs and symptoms that I would add up is weight loss. Okay. You realize that you are just losing weight. Meanwhile, you are not doing any dieting or anything. You are just losing weight. The weight loss is so glaring that you yourself feel like, that's why losing kilos will be within a week or a month. And you see one major signs and symptoms. Until you can reduce weight as in your obesity fine, but not the weight loss that apparently you don't see any other signs and symptoms, but weight loss, you should query it. Not necessarily cancer, but it could be anything. Okay. So weight loss. So coming back to the prevention, so we check our weight. We eat well to check our weight. The fruits and vegetables, I'm so passionate about how we even wash it. It's very important because in the era of fertilizer and all these things going on, we need to wash our fruits and vegetables properly. We have the salt. We have the plain vinegar. The salt is a natural thing for us. You know the good it does. So you wash your vegetables thoroughly in water 3-4 times. Then you now have a salt water in a basin or a bowl. Then you put them in the salt water for 5-10 minutes. Then you rinse them off because some people don't eat salt. Yes. So you rinse it off. Then you start cutting into any shape that you want for your stew, for your salads, and etc. Likewise, the vegetable, the contomere and co. We should take time to pick the contomere and wash them one after the other. Sometimes we feel lazy, but it will go a long way to help us. So that is true that we check our weight, one of the preventive measures. Then we have to be physically active, exercise, because the gym, people said, oh, they can't pay for gym, it's too expensive. Yes. Just walk, take a walk, 30 minutes. Brisk walk, not the lazy walking. If you like, you can get a company to help. But safety reasons, I always say as a policewoman as well, you should know your environment, the timing of your exercising, and where you walk. Maybe along the road on the pavement, you don't walk on the road by the pavement or on pedestrian walkway to be able to be safe. So you do exercise and you are good to go. Then you limit alcohol intake. Either you limit it or zero. Some people don't take at all. And to add to the alcohol, our fizzy drinks, the carbonated drink. I'm not spoiling anybody's business, but too much of everything we learned when we were in kindergarten is bad. Yes. So the fizzy drinks, the soda, the minerals, we call it in Ghana here, Fanta, and those things. Anything you open and that sound comes. We have to be careful about it, together with the alcohol. Alcohol, a lot of people add the tramadol. There are so many things to alcohol nowadays. Abused, all the people do mixtures and gallons at funerals and co, and they'll be passing on to each other. We should be careful what we put in there. Then the smoking, you shouldn't smoke. You should, if you are smoking, try to quit. You should have a therapy. There are so many therapies all over the hospitals they can do for you. If you are just ready to quit smoking, even the alcohol, if you are ready to stop drinking, they can help you. So if you want to drink, you drink in moderation, or you limit how you drink. Then breastfeeding. Breastfeeding is very, very important. It helps because as a woman, when you are breastfeeding, hormones work. Some hormones are relaxed, some work. So that the system is balanced. And the child also gains a lot from the breast milk. Yes, sure. So breastfeeding is good, but some people have conditions that they'll tell you don't breastfeed. It's different from this breastfeeding. The one I'm talking about is some women don't have any condition attached, but they'll tell you, oh, I don't want my breast to sag. My sister, whether you like it or not, as you age, it will fall, it will drop. So if you don't have any condition, you can breastfeed your child, and that will be okay, and it will help you. Then we come to hormone therapy that I already said. The menopause women, some add hormones for them to feel comfortable. It's a season. It's not easy because signs and symptoms of hot flashes, ube feel during menopause no almost say easy ni amu edu ho na amu apa won ni na almost say easy but what the hormone do we can say oh person would do that stage but how long can you be taking the hormone say ube cut it away a draw pills be aya amunum ebumu injections aya amuma just to keep up the natural body na nipa no to avoid all those hot flashes in your kikam. Some of them might cause breast cancer. So that is also another. Now, we should find out about our family histories. Say be our family, no, auntie be because all my practice up to date we are sitting here. When you ask somebody taking history and you say, family will be well cancer, that everybody, almost 99 will say they don't know. Yeah, because if you are our culture, nobody even wants all. Truthfully, they don't know. Because those days, cancer is not so like that. Those right now, civilization is here. So we now have a lot of discernment to know a lot of things that is going on. So avoid birth control pills. And also, that one too, you are not here to spoil anybody's business. But there is a particular way you have to take it. Family planning is good. So you do your family planning. Maybe I've given birth, I want to give birth again maybe in 2 years. There are things I will do. The family planning nurses, the midwives, they will help you. But say you don't want to, you won't give birth again, you are done. Then the health personnel, they advise you on some of the things to do. You say, oh, I still want to take the pill. For how long will you be taking the pill? The pill is a hormone. So long-term management of family planning, pills need okay, but it's short-term. So you give short-term to short-term when you want to do the long-term to do. So you don't do what is not supposed to be done. And on that birth control pills, I'd like to talk about the emergency birth control pills. Of late, a lot of youths, especially the female, they abuse it. Even the guys or the men buy it for them. When they have unprotected sex, they go for the emergency pill, and not once, because it can happen. Emergency is emergency, but now they use it like routine, like paracetamol. That can also cause breast cancer and any other cancers. Because at the end of the day, the name is emergency birth control pill, not daily birth control pill. So that is the difference. So we have to be careful about how we use this thing.
Before you go on, I would want to reiterate first. And so for anybody out there watching us right now, you would want to take care and then hear this one. That emergency control pills are made for a reason. They are not to be taken like you taking it every day. And so if you have any birth control issues at all, then it is best that you seek medical attention. You go to the hospital, you go to the clinic, and then see the medical professionals who are trained to take you through some of these things, because it is advised that it is going to harm your health, and then continuous intake of these emergency pills are going to harm your health in the future and may cause breast cancers. Let's continue, please.
So the another preventive measure is breast self-examination, clinical breast self-examination, examination, breast examination. So we earlier on talk about this breast self-examination. Near Obeyama and near hospital for so and a mammograms and ultrasound now. If you say and since we are in October, you take advantage because a lot of people complain about it means it's expensive. Then I tell them that Fadi birthday man, because birthdays that we celebrate, we do photo shoots, we do a lot of beautiful things. But you complain that we don't have money to do mammograms and co when we need or to check ourselves. No, we should learn to love ourselves. If you love yourself, the love will spread to others. So the birthday man, for who go hospital, that's I'm doing my birthday, so this is like a birthday gift for myself. I want to do mammogram, I want to do this, I want to check on. Not necessarily only that, the blood pressures, the sugars. There are so many things you can do to yourself.
That's true.
So these are some of the preventive measures of breast cancer. There are others, but these are the few.
Oh wow, that is very, very insightful. And so, ESP, we want to find out some of the challenges that you health professionals, especially in the field of oncology, have come across with the treatment or dealing with breast cancer.
Okay. Dealing with breast cancer, there are so many challenges. Late presentations, meaning that they come late.
Okay.
They will go to the herbalist, they will go to so many places before coming. So it's a challenge.
Okay.
So early detection, that's how come we preach early detection. Every year, Pink October, they preach early detection. It's like, come early. Let's know what is going on. Even if it's not breast cancer, any change in your breast, because naturally you are okay, there's nothing wrong. One day you have rashes, you have hotness, you feel there's red something on your, it's not normal. Just go, get to the hospital. We are there for you. We went to learn so many years of schooling and all that just for human to come, just for you. So just come, so that at the end of the day, golden key is early detection.
Sure.
Then the earlier, the better. It opens a great way for the success in your journey as being diagnosed with any of the cancers, especially breast cancer as well. Then we have a challenge. So when I say the challenge, I try to put across the way forward.
Sure.
That is in Ghana. So sometimes you have culture and traditional practices.
Yes.
Somebody will say, so, juju, obi na eyo, obi na etan. We have all those spiritual words. That one I will not downplay it. But physical is there. You just go. Let the spiritual follow. Then it will help. Then we have marital problems, as I earlier on said. Men run away from their women. Most of them, it's not their fault. It's not that they are wicked. But one day you get up, your wife, things are happening, then the breasts. Because men like breasts so much that it's natural. That men, that is like a romantic sort of organ that they like on their women or partners or their wife. So one day it's becoming sore, it's smelling, gogomi or maggots are inside. This man can run away. But all I would like to tell our men out there is they should just always, it's not easy, but just get the women, stay with the women and help them. Because if it's you, they need the support. If it's you, they will be there. So the women need support.
I think the men can as well help the women in detecting some of these things. So
yes.
If there is any education for the men out there, apart from supporting them to seek treatment, what else can the men do to help their women in such instances?
So there's this myth that sucking of breast is when the man suck a woman's breast, it will prevent her from getting breast cancer. It's a myth. Okay. The truth is that sucking of it or touching the breast by a male can help detect a lump in the breast or changes, because he is looking at it, he is holding it, he is doing all that he is with. Oh, most women come, they said, oh, she herself is not even doing the breast self-examination, but the husband. So that is the way they can help. But not to say, so I'm demystifying this, not to say, oh, make breast October, so I'm going to suck a lot of women's breasts so that they will not get breast, or suck my partner or my wife's breast so that she will not get breast cancer. It's a no. That myth is there, and
okay,
it's
so
a no-no.
To the men at home who think that sucking a woman's breast is going to help prevent breast cancer and all that, please, disabuse your mind of those. It is good that you help to detect if there is any defect in there, and then it is a one sure way of getting to know better and then seeking treatment for all of this. But Mameness says it is not true. It is a myth. So please disabuse your mind of that. Yes.
And the last challenge that I would like to talk about is lack of family support. Okay. On the aspect of the people being diagnosed with breast cancer, or women and men being diagnosed with breast cancer. The financial support, the emotional and the psychological, most of them lack it. You realize that when this patient is in the ward or is the patient has come for a review or even a first appointment, just maybe a child. Sometimes teenagers bring their parents, an auntie, or even the husband, some bring them, by just one person. Then when we need medication, money for tests and co, it's just the same person going around, going to solicit fund, looking for money. When you ask them deeper a little bit, or you want to nose around a little, they'll tell you, I'm the only person. Obi any ho. Ayari we yeah me mami and I me auntie no be amba. And I feel so bad because we are in the clinical setting and in the hospital. Most people will come and lie in the hospital on admission. They are sick, just 1-2 people going around. But when they die, you see people of class wearing the black. Their car keys shows the cars they are driving, the monies they have. But we never saw this. Then they come, they want to take death certificates and go and attend to the dead body now in the morgue. So sad. Let's love ourselves or each other whilst we are alive, not when we are dead. So this lack of family support, please, let's support people being diagnosed with cancer, any cancer or specifically breast cancer.
This has been an insightful one today. So, Madam, give us your last words.
In conclusion, I would like to just urge all of us to early detect breast cancer. Early detection means what? You do all that earlier on said. So early detection saves life. We all have to get involved because it could be you, it could be me. We are not better than the people being diagnosed or patients who have been diagnosed with breast cancer. We are not better than them. For this Pink October at the police hospital, we have a free breast screening at the family planning unit from Monday to Fridays, 10 a.m. to 2 p.m. So just make a date with us and go get your breast check. Both men and women, male or female. You're all welcome. Thank you.
Thank you. So to what the support Madam Harriet OWUSU-ADJAH said, there is help or support for us all at the Ghana Police Hospital for Mondays to Fridays, 8 to 2 p.m. Just walk in there, and then they are stationed at the family planning unit of the Ghana Police Hospital. Walk in there, and then the help for the examination that you need, and all the answers that you seek shall be addressed over there. So if you joined us here today, we talked about breast cancer and anything that you need to know about it. And we had Deputy Superintendent of Police, Mrs. Harriet OWUSU-ADJAH of the Ghana Police Hospital, who is a specialist nurse oncologist, or any nurse at all that are specialized in cancers, joining us here in the studios. Thank you for staying with us. I am Chief Inspector Priscilla Nkrumah Pepra. Thank you.
Thank you for having me.